Good morning. Welcome to our live stream of spine surgery here at Deuk Spine Institute. It is September 24th, 2024. I'm Dr. Ara Deuk-Majan, CEO and founder of the Deuk Spine Institute. Our patient comes to us from Miami, Florida, about 3.5 hours south of where we are on the Space Coast. And she has had a really unfortunate history with respect to her spine. She's got multiple spine issues. She's even been partially paralyzed in the neck from an accident, and now she presents to us with what's called adjacent segment disease. She had a lumbar fusion done by a different surgeon. You can see it on the x-ray. Can you see that, Henry?
Yes, we can.
And now she has what's called adjacent segment disease. Little stick. Everybody agree, right side? Adjacent segment disease, for those of you who don't know what it is where you do a fusion or put an artificial disc in the spine. It changes the biomechanics of the spine in such a way that it accelerates the degeneration of joints above or below where you operate. In her case, both. She now has sacroiliac joint pain and piriformis syndrome. We're not treating it today. She didn't want to treat it today, but we're going to treat it in the future for her. Now today we're just treating the bad disc above the fusion. She has a fusion. You can see, Jordan, show us the screws and rods. You see the arrow pointing to the screws and rods, John?
Yes, we can.
All right, well, those screws and rods, and show us the cage that was put in. This would be a good one for Sanjay, by the way,
Copy that.
if he wants a nice adjacent segment disease. Lumbar spinal fusion. This would be a good x-ray picture for him. Just lay still, you're doing great.
Copy that.
Now she is awake, helping me to get to where I need to go. Once we get there, I'm going to put her completely to sleep. My anesthesiologist, Dr. Berndes, will. But we need her awake right now. Shot, can you guys have questions? Feel free to ask me. I'm happy to take your question. Shot? Let's hope and pray we can get to where we need to be. This is obviously a very difficult area. Jordan, show the audience all the scar tissue, all the bone hypertrophy of the facet joint above the fusion. Look at this, folks. All that gray material there is extra bone. It shouldn't be like that. That's from arthritis affecting the facet joints above her fusion. That's what happens when you do fusions and artificial discs. You get adjacent segment disease. Turns out the rate of adjacent segment disease is the same for fusions and artificial discs. Artificial discs were supposed to preserve movement. Perfect. You can see the cages at L3-L4. Show us the cages. Now I'm going to tell you something quite interesting. This system here, Henry, I want you to keep this x-ray here. AP and lateral for Sanjay. Send him pictures for the website. This is a very interesting implants. Number one, the cages are called BAK, capital B, capital A, capital K cages. They're the first interbody cages that were approved by the FDA in the United States. They're the earliest ones used. So clearly this surgery was done a long time ago. Second of all, the implants are fascinating. Look at those implants. Those screws, show us the S1 screws. You see they're like a post, and then they have a connector to a plate that then has an offset medially placed rod. This is called TSRH, Texas Scottish Rites Hospital implants. They were popular back in the 90s. I used them in the 90s, and then we moved on to what are called polyaxial screws, which was developed by Michelson. But this is an old system in the 80s and 90s, no longer in use, called TSRH. Keep that AP view, Henry, just right there. I want that with TSRH across the top and on the website in our photo gallery. Photo gallery. Tell Sanjay photo gallery, okay?
Copy that.
Thank you. Let's go back to a lateral view. Beautiful. Yeah, 96 would have been exactly when the TSRH system came out. And I was implanting it in 97 with my team at Shands. Okay, so looks good. We're approaching the bad disc on the right side. Now, she said that she is having pain on the left side too. She only wants to fix the right side today. That's what we're going to focus on. Any questions, feel free to type them up. In the meantime, Henry, let's show the audience, actually, let's just wait 1 minute and then we'll show the audience a video on the different causes of back pain.
Copy that.
Sean, let's get an AP. Hopefully we can do a discogram. Is she awake? Yep. Oh, good. All right, everything's going well. Your surgery is going as good as it possibly could. Remember, Henry, TSRH, Texas Scottish Rite Hospital, Sanjay website, photo gallery.
Copy that.
Shot? All right, so we are now there. How much back pain do you get? A lot? All right. Are you feeling any right now? No? Good. So everything is going perfect for you. We're going to put you to sleep in just 1 minute. Are you comfortable? All right. So how bad is that on a scale of 1 to 10? 10? Is that where you get your back pain? Congratulations. That's going to go away when we're done. We found it. 10 out of 10 concordant. You get to go to sleep. I want you to count from 1 to 100 out loud for me. Can you do that out loud? All right, folks, great news. We just injected dye in the L3-4 disc. She had a reaction. You saw her arch her back. That means it was painful. She's still moaning about the pain, and we're going to fix that pain for her. That's the great news. She is unfortunately currently like in a wheelchair situation because she's in so much pain, but she also has partial spinal cord damage from the cervical spine. We did get an MRI, made sure that everything looks good. There's no cord compression, but just count out loud for me, okay?
We're doing great.
But she's doing very well, and we found her painful disc. Shot? That said, she still needs to have her piriformis and sacroiliac joint treated. She refused to do that today, and that's okay, but we're going to have to come back and do it. Local? Any questions from the audience?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is a herniated disc causes back pain?
Let's do that. And then after that, we'll show the Deuk laser disc repair, how this works, and then we'll go into the 30 causes of back pain.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see how a disc herniation actually causes back pain. Now, it's not just a disc herniation, a disc bulge, disc herniation, slip disc, ruptured disc, extruded disc. Any of those, degenerated disc, they all cause back pain the same way, through inflammation in the tear. We're going to go in right now, use a laser to clean out the tear and get rid of the inflammation. It's not something you can see on an MRI. It's something that we know based on our experience. 87% of back pain comes from, hold on a second, comes from a disc injury. Is the laser 220 or 110? How many 220 plugs do we have? Fluoro is 110. All right. We're going to get started in just a moment. Henry, have we shown the audience how the Deuk laser disc repair cures back pain from a disc
Not yet.
herniation?
We have
Let's
not.
do that. And then let's start the 30 causes of back pain, 30 most common causes.
Copy that.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine touches the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. Yeah, I know. Welcome back. I know. Welcome back. I'm Dr. Deuk Majan once again, and you've just watched our new animation created by Deuk Spine Institute, by myself, with the help of a few other people like Henry and our animator. And it shows that there are more than one cause of lower back pain. And the key to making the diagnosis to what's causing your back pain is the physical exam and the MRI. If you can do a physical exam and an MRI review, which we do free, by the way, our free MRI review, then I can make a diagnosis as to what's causing your back pain. And like I said, the most common cause is a herniated disc. When I say herniated disc, I mean degenerated disc, herniated disc, they're all the same, a disc injury. So we like to use the term disc injury because it's more generic. There's a piece of herniation right there. Disc injury is more generic. It means herniated disc, bulging disc, ruptured disc, protruding disc, extruding disc, degenerated disc, spondylitic disc. So any of those conditions is what I mean by disc injury. All right, let's see if we can bring this laser in and try to remove these abnormal herniation. And see a piece of herniation right there, just stuck there.
Yes, we do.
We are inside the tear of the disc, the annular tear. We're in the deepest part of the tear. We're going to use the tube to move backwards and slowly remove the tube out of the disc tear. And as we do that, we're going to remove all these pieces of herniation. This is a pretty big piece of herniation. We're in the lumbar spine. This is the lower back. The lower back surgeries outnumber all other types, cervical and thoracic, thoracic being the least common. But lumbar spine surgery is the most common. And we do about 3/4 of our surgeries are in the lower back for lower back pain. The other quarter are cervical and thoracic. I know we have some questions. If you have questions for me, I'm Dr. Deuk Majan, the surgeon. I'm actually operating right now. You're watching me operate. If you have questions, feel free to ask those questions. We want to address your questions. We want to give you the answers you're looking for. People need answers. Why are they having pain? What can be done about it? We want to give you those answers.
Yes, we have a couple of questions. This first one coming from Ping on Facebook.
Hello, Ping.
Saying, morning, doc. Would taking testosterone and human growth hormones after this procedure speed up recovery?
Ping, I don't think taking those testosterone or growth hormone would speed up recovery. I, would not recommend it. We've been doing this surgery now for 19 years almost, 18 and a half, and I've never recommended testosterone to anybody or growth hormone, and people heal up just fine. If you think about it, there's a 99% chance you're going to heal fine and you're not going to have any reherniation, 1% chance of reherniation. I don't see a correlation between testosterone, growth hormone, and reherniation. So I would say don't add anything into the mix That would be like baking a cake that you know is an award-winning cake, and then you want to add some more ingredients to it. Why would you do that? You know, those ingredients could make the cake taste bad. So don't take a chance. Go with what you know works, which is this procedure without growth hormone and testosterone, and leave it at that. There's an old saying in America, if it ain't broke, don't fix it. All right, next question if there is one.
Next question coming from Brad on YouTube.
All right, Brad.
Asking, what is the difference between a bad Schmorl's node and a compression fracture in the lumbar spine?
Yeah, so a Schmorl's node is basically a place in the bone where the disc material has gone up into the bone. It's not a fracture. It is something you're born with. And fractures are when the integrity of the end plate is compromised by force and the end plate caves in. By the way, this is herniation. This is a good sized piece. Henry, you want to show the audience?
Yes, sir.
I've been taking out pieces, but this is probably the biggest one so far. Can you guys see this? Light on, please.
Yes,
Come
we
on.
can.
Here's a little ruler so you get an idea of how big it is. Now I want you to pay attention. This is a beautiful piece. Why? Because remember what I tell you folks, okay? I tell you that this piece of herniation gets stuck in the tear of the disc, the tear in the wall, and you get inflammation. Look at the pink color. Can you guys see the pink color?
Yes,
I don't know if the camera can pick it up, but there's a really distinct pinkness right here. That's inflammation. So the body's been attacking that piece of herniation, trying to get rid of it, dissolve it into little pieces, unsuccessfully. So there it is. That's probably the main cause of her pain and symptoms right there. Now, are we going to get 100% of the herniation? No. I tell people we never get 100%. No doctor can get 100% of the herniation. It's impossible. So how much herniation do you need to get? In my experience, you need to get 50%. 50% or more. What's my average? Probably around 60%, if I had to guess. I don't have an exact number. I've never been able to measure it, but that's based on doing 2,150 of these laser surgeries. What is the average herniation amount that's gotten by a microdiscectomy? Less than that. And more importantly, microdiscectomy doesn't take out the herniation where it needs to come out from, which is the tear. Microdiscectomy is unfortunately a destructive procedure. You want to show us the microdiscectomy video? Do you have it, Henry?
Yes, we do.
Watch this video animation and you'll understand how destructive microdiscectomy or discectomy is. That's why we don't recommend it, because it causes the spine to become unstable afterwards. And then you'll need a fusion along with pain management. And welcome back. So you can see the microdiscectomy procedure requires a much larger skin incision, so there's more trauma to the skin, more chance of infection, more chance of wound complications. There's also the muscle underneath the skin is being cut and basically destroyed. And so they're cutting out a piece of your muscle. and you get scar tissue there instead of the muscle. Scar tissue, of course, is bad. We don't want scar tissue if we can avoid it. With the Deuk laser disc repair, there is no scar tissue in the muscle. It's basically a no muscle damage procedure. So with microdiscectomy, the next thing the surgeon has to do after they destroy the muscle by cutting it to get it out of the way so they can see what they're doing, they're going to take the bone out of the back of your spine. And I'm not talking about bad bone, I'm talking about good bone. The bone that you need, it's called a lamina. They're going to take the lamina out. They're also going to take out your facet joint, which they're going to cut half of the facet out. Now the facet is necessary. It stabilizes your spine. It's a joint. God put it there for a reason, to hold your spine together. So if you start shaving off the facet joint, which is what's done during a discectomy, not this procedure, but during an open discectomy, then you start shaving that, I've got 5 minutes. You start shaving that facet joint off, now the spine wobbles. And guess what? That causes pain and instability. And then you get a spondylolisthesis as a result. And the surgeon, you go back and see the surgeon and they say, oh, we need to do a fusion now. Well, they knew that to begin with. They shouldn't have taken off that bone in the first place. Underneath the bone, you've got ligaments, specifically the interspinous ligament and the ligamentum flavum. And those ligaments actually hold your spine stable. As a matter of fact, those ligaments get thick afterwards because they're trying to stabilize your spine. So you get ligamentous hypertrophy, bony hypertrophy, all trying to stabilize the spine after a microdiscectomy. It's a very bad procedure. It's an old type of procedure. Then you get down to the epidural space where the nerve is, and guess what? You must move the nerve over. It's called a retraction. You got to literally grab the nerve and pull it. And that's where a lot of nerve damage occurs during that procedure. And that's where a lot of spinal fluid leaks happen, when their surgeon is manipulating and moving the nerve over. Okay? Then you get all that scar tissue around the nerve from that procedure. And finally, they're going in and taking out with the grabber the chunks of herniation they can get, but you can see the grabber doesn't work to get rid of herniation. It only gets out a little bit of the herniation. So they're in there cutting and scraping and basically destroying your disc just to try to get the herniation out. But in the end, they're not repairing or debriding your annulus. And you have no chance of debriding and repairing your annulus afterwards because they didn't clean all the herniation out. Because they can't see it, number one. Number two, they don't have the right tools. The right tool is the laser. See that piece I just took out right there? In a microdiscectomy, that would have been left there. And the patient would never heal their annulus. So Deuk laser disc repair is truly the only surgery that allows the annulus to be healed. No scar tissue, virtually no bleeding. The nerve is right there, right there. See how red it is? That's the nerve root, okay? It's red. Why? Because of inflammation. I'm going to get just below it and try to take a little more of that herniation out. But we're pretty much done. I got a minute left. Is everything okay with the laser? Sorry. Yeah, so you guys could see the inflammation, the pink stuff. That's from the disc inflammation affecting the nerve root. That's why she has her right leg symptoms. The nerve was getting pinched and irritated from inflammation. We're done. I really hope she does well. She's still going to have her piriformis and sacroiliitis. We're going to fix that later. She's going to have to come back and get it done. Her sister's here helping her. She's from St. Louis. And what a great sister, huh? To come out and help her family member. Just to help her sister get well. I'm really impressed with her. I'm going to take your questions in a moment, but I'm going to come talk to you guys face to face. So I would encourage you to type up your questions. Let's show the audience the tube that we did the whole surgery through. Can you guys see this?
Yes, we can.
The whole surgery was done through this 7 millimeter wide tube. That's why we say that the incision is 7 millimeters, because that's all it is. Now, underneath the skin, you have muscles and fascia. We didn't cut them, we spread them. They're like the fibers of a cloth on your shirt. Like when you put a pin in your shirt, you're not cutting the fibers, you're actually spreading them. And then when you take the pin out, the fibers go back. So you're not doing any damage to the muscle with this surgery, but you do with invasive surgery. I got a rate tech off the field. Type up your questions. I'm going to come answer them face to face. Our next case is going to be in here. And it's a Deuk plasma rhizotomy for facet joint pain. Cervical. So Henry, I don't know if you have cervical facet animation video. You could show the audience what the next surgery will be.
Copy that.
While I'm making my way over there.
Copy that.
I'm here with a gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the laser and we cleaned out 2 discs that were really causing pain in your back. They were herniated and starting to degenerate. How do you feel today?
10,000 to 50,000% better. Absolutely wonderful. I can't even, it's hard to explain. Going from not being able to walk 5 feet to being able to almost just walk around the block. It's one day. I mean, it's 24 hours. It's incredible.
And when did you realize you had this relief on your back?
Yesterday, when I got home and got settled down, and there was no pain. There was no pain in the back. There was no pain all the way down the leg to the big toe. It was like, where'd the pain go? It just dissipated. And that's after surgery. So usually you feel like there's surgery, there's going to be some pain. No pain. I can't even explain it.
Well, you're doing a good job. What was life like before you had the Deuk laser disc repair surgery?
I didn't want to live this way. There was no way I would never want to live that way. Never want to, no. Excruciating pain. I mean, can't sleep, awake all night. The pain was constant, it never left, but you got so exhausted from feeling the pain that you would finally fall asleep. I would finally fall asleep anywhere from an hour to 2 hours at the max, and 2 hours was a gift, and that's all night long. I had to sleep in the room by myself because I would have kept my wife awake all night. I was just miserable, the most misery I've ever felt.
I met your wife. She's a lovely lady. She's by your side all the time.
Yes, sir.
It's hard when you have so much pain. It takes a toll on you, but also your loved ones.
Yes, it does. And she's been a God's gift. I will say that.
Now, how does she feel about your surgery you had yesterday?
She's very happy for me. She's been through every day of it. And this started before Thanksgiving. And we are 3 days from Christmas. And I'm going to have Christmas without pain. Thank you, God. Thank you, doctor. Thank you, everybody in the staff. This staff is unbelievable. Nicest people I've ever met.
Well, we care about people like you. We want you out of pain and happy and getting on with your life. And tell me about your job. You have an interesting job.
I do. I love my job, and I call it the greatest part-time job in the world. One of the highlights of my job is something I can say about it is it's a job where you can say no to work and you'll have a job the next day. It's the only job in the world that I know you can do this. I'm a stagehand with the International Alliance of Theatrical Stage Employees out of New York, and I love my job. I do everything from entertainment, theaters, arenas, to trade shows.
What's the best show you did?
I've worked with 2 out of 4 Beatles. I've worked with, everybody from Kenny Rogers to Celine Dion. I've worked with Van Halen. I've worked with I've worked with all big entertainment. And then I've done a lot of medical trade shows, so I know where I'm at. When I come into a medical facility, I look around and go, oh, I know where that comes from, and I know where that comes from. And it's a great job. It's a wonderful, wonderful job. I see things before normal people see things. I saw the first flat screen computer and I didn't think too much of it because I wasn't a computer person. Now it's like, look at the flat screen TVs, and it's a great job. That's the trade show side, the side where what keeps our country moving is people buying and selling the products that we use, from the cameras that are on us right now and the lights that are on us right now to doctor's coat that he's wearing and the shirt that I'm wearing. So
and probably some
incredible.
of the equipment we used in your laser spine surgery.
Absolutely. The best shows I do, I have to say, are the medical shows, because I go around and I get literature and I read and I learn from past experiences with herniations. I've had double hernia surgery, so I know about that. I've had hand surgery, I've had knee surgery, now I've had back surgery, so I learn, and it's, you get to talk to the people that do the work and represent the products, and it's pretty awesome. So I love my job. I miss it. I honestly miss it.
Well, now you're going to be able to go back to work without that pain.
Oh, thank God. Thank you. Thank you, Doc.
You're welcome. Is there anything else you want to say to your fans out there?
If you're having issues, any kind of issues with back, knees, joints, you need to come to Deuk Spine. You just have to. The Institute is wonderful. Everybody here, there is no negativity in this building whatsoever. It's unheard of out there. And I've seen a lot of doctors over the years for different reasons, but there's no negativity here. It's all positive, and you leave positive. So I'm very, very happy that I did this. And I tell anybody that has ever gone through any kind of pain, you need to come see Deuk Spine. People come from all over the world, and now I know why. I just came from up the street, so I can tell you, up the street or from another side of the country, just come to Deuk Spine. That's the best I can tell you.
Well, thank you for sharing your story. Congratulations and Happy New Year.
Happy New Year and Merry Christmas to the whole staff. All your people are excellent, to your family as well, and their families. And I hope everybody has a wonderful Christmas. And by the way, the office is magnificent. That is the best I've ever seen. That shows when you walk through this office for Christmas holiday, it's all about family. It's all about the holidays. It's about the people that come through.
Thank you.
Thank you
very much. It is a great day. I'm actually had an opportunity to meet one of my fans on YouTube. And I'm Dr. Deuk Majin. You've just watched one of our patients who underwent the Deuk laser disc repair and had a very good outcome. So we've just completed the adjacent segment disease surgery on this patient at L3-4. Now remember, she had a fusion done from L4, L5, S1, and above the fusion the disc blew and we went in transforaminal from the side without damaging any bone or ligaments, went in and repaired that tear, removed that herniation. She's going to do fantastic. She had 10/10 pain. When I tested the disc, is this a painful disc? Is this where her back pain's coming from? Just want to be sure. We tested it with a discogram. It's called an evocative discogram. 10 out of 10 pain. She came off the bed, she was like, ah, and it was concordant, meaning that's her typical daily pain. That's what concordant means. So if your pain is coming from your elbow every day and I smash your wrist, is this where it hurts? And I smash your wrist, it's gonna hurt, right? But it's not the pain you get every day because it's coming from your elbow, not your wrist. So we call that discordant pain. It's not the same. But concordant means it is the same pain they get every day. So it's a good sign. That pain's going to be gone now because it was coming from her disc. And Deuk Spine Institute's the only place in the world that does these disc repairs for disc pain. We're the ones who discovered the disc is the cause of pain about 20 years ago, and maybe longer than that. Yeah, about 20 years ago. And I've been performing these laser surgeries for almost 19 years now. All right, let's take some questions.
All right, first one coming from, forgive me if I mispronounce, Siwang Liu on YouTube.
Silong Liu?
Siwang
Liu.
On YouTube, asking, what if an annular tear is not detected by an MRI and the disc seems okay? on the MRI. However, in reality, there is an annular tear. How do you deal with this situation?
So Si Wong Liu, first of all, if you show me an MRI that's a good quality MRI, like 99% of them are good quality MRIs, without motion artifact, it's just a regular 1.5 Tesla or less, it's fine. I can tell you if there's an annular tear. And the way I can tell is I look for a bulging disc. I look for a change in the contour of the disc in the lumbar spine or cervical spine. What does that mean? What that means is that if you look at the back of a normal disc on an MRI, right? So you're looking at the disc. Let me just grab one here, okay? This is the disc. We've taken it out of the spine. This is the front. This is the back. The back should be concave to the bone, to the vertebral body. If you look at it, it should go in like a curve. If you see a straightening of that, there's an annular tear, there's a disc bulge. The problem is that radiologists miss them all the time. Out of every 100 disc bulge, it's probably missed at least 50% to 90%, depending on the radiologist. But there is a tear and there is a bulge. If you have a tear and a bulge, that could be the source of your pain. I'm not saying it will be, it could be. Now it's up to me to figure out if it is. So if you have an MRI and you're having back pain, you need to do our free MRI review. It's done with Zoom. Doesn't matter where in the world you are. We'll do a free MRI review. We have people from Australia, from China, Hong Kong, Thailand, Philippines. I mean, you name it. South America, North America, Europe. It doesn't matter. We have people all over the world. We do free MRI reviews on Zoom every week, and we diagnose the cause of back pain and neck pain and thoracic pain. So happy to do that for you or anybody. It's free. We don't charge. We want to help people understand where their pain's coming from, but more importantly, we want people to know it can be fixed. They just need to come to Deuk Spine Institute. We're the world leader in curing back and neck pain.
Next question coming from Amit on YouTube.
Hello, Amit on YouTube.
Asking, do you do an annuloplasty after removal of extruded fragments?
Yes, Amit, we're not doing an annuloplasty, we're doing an annular debridement. An annuloplasty is a shrinking of the annulus, and that happens with the annular debridement. So it's part of it.
Next question coming from Davo on YouTube, asking, what are your thoughts on vertebrogenic pain and basivertebral nerve ablation? I have pretty massive modic changes and severely degenerated discs at L4-5.
Yeah. What's the name?
Davo.
Davo from
YouTube.
From YouTube. Davo from YouTube, Dr. Deuk Majum. Okay, I have to be careful what I say here because the company that owns that technology is Boston Scientific, and I am considering working with them to roll out my technology. So I have to be careful what I say. But let me just say it to you this way. I would never do, myself would never do the basivertebral nerve ablation because I've never seen it work, and I don't think it works, and I don't think they're doing the right treatment for patients with back pain. Modic changes do not cause back pain. 100% they do not cause back pain. So I hope that answers your question without saying too much negative about the procedure. I would never do it. You couldn't pay me enough money to do it because I don't believe in it. And I know where pain comes from. It's not the modic changes.
Next question coming from a two-part question from Ping on Facebook.
By the way, check out our website, deukspine.com. We have a treatments section, and in the treatment section we have basivertebral nerve ablation, an entire page on it where I give you my thoughts about it objectively. So you can actually see some MRIs of patients that we've seen that had it done elsewhere, and you can see the holes in their bone from burning the bone and destroying the bone marrow, and they are unbelievable. I would never do that to a patient. It just doesn't help. It doesn't help one bit. Okay, it is a horrible idea to do that procedure.
Next question coming from, Ping once more on Facebook. Two-part question. First question asking, with limited/no blood supply, how does the disc heal over time? Thanks again.
Yeah, Ping. The disc does have a blood supply. If you divide the disc up into the center called the nucleus, there's no blood supply. If you look at the ring around the disc, there's 20 layers of collagen, 20 layers. The inside 10 layers has no blood supply. The outside 10 layers does. So there is a blood supply. It's just in the outer part of the disc. That's where the healing has to occur.
Second question from Ping asking, also, what are your thoughts on ozone injected directly into the disc?
Ozone injected into the disc, you might as well inject ozone into your knee. It doesn't do anything. It's useless. There's a lot of useless techniques and technology that do not help patients get better. They don't address the source of pain. They are just money makers for the doctors doing them, and they don't work. And the reason doctors do them is because they buy the machine and then they put out ozone therapy, and people like you come like a moth to the light, you know. Ozone, if ozone worked, we would be doing it at Deuk Spine Institute. Maybe I should add that to the website.
Yeah.
Will you send an email to Sanjay to add a treatment page, ozone therapy,
Okay.
for the disc injury?
Copy that. And next question coming from Lanu on YouTube asking, all of the animation videos are very easy to understand even for people who don't have any medical background.
Thank you, Lanu.
How did you make these videos so good?
Well, Lanu, first of all, thank you. I appreciate your sentiment and comments. It means a lot to me. I spent a year and a half personally supervising the production of each animation to make sure that the animations taught the viewer, the user, all the important things to understand about the disease or how we treat it. And I spent, a year and a half to 2 years literally working, not daily with the animator, but almost every day to, make the animations perfect to every split second so that it highlights everything going on. It just took a lot of time and effort, and I incorporated everything that I've learned about back pain and neck pain and what causes it. I incorporated all that into my animations. You'll never see those animations anywhere else in the world because other doctors do not understand the source of back pain or sources of back pain. They don't understand how a disc causes back pain. They don't understand how facet joints cause back pain. But we understand it. We know the pathophysiology of the disease, which is basically the mechanism by which the disease causes pain or symptoms. We understand that. We know how to fix it. We've been fixing it for years. And the fixes we do they're like a ninja attack, right? Very focused on exactly the right location, okay? And so we are able to use very small incision and go directly to the source of pain and fix it because we know where the pain's coming from. We put all this out there so everyone else could find out. The problem is doctors are not doing what they're supposed to do, learning about back pain, what's causing it. They're not listening, they're not caring. They want patients to stay in pain. They want you to be in pain so they can keep writing you prescriptions for pills, keep doing shots, keep doing procedures, do stimulators, do basivertebral nerve ablation. They want to do procedures that don't work because you will come back in pain and then they'll do something else. They'll make more money. So it's wrong what they're doing. We want you to know the truth. We want you to get fixed. We want you to be out of pain. We want you to stop suffering. I want you to stop suffering. So it is my goal as the CEO and founder and the pioneer of all this technology, it is my goal for people to stop suffering. That's my goal. And pain is probably the biggest cause of suffering in the world,
Probably, yeah.
right?
Yeah.
If you think about it, move hell aside, right? In this life, pain is the biggest cause of suffering. I think, pain. Of course, there's other causes of suffering, but pain is the number one. So I made it my life's goal, with God's direction, to focus on curing pain. And that's what we've done. Now, other doctors are not interested in curing your pain. They're interested in making money from you over and over and over again, bringing you back, doing treatments that don't work. That's why we don't do treatments like basivertebral nerve ablation, ozone therapy, microdiscectomy, fusion, laminectomy. We don't do them anymore. Why? Because they create new problems for the patient and bring the patient back for more treatment. We don't want people coming back for more treatment. We want them being fixed and gone. Now, if you have a cause of back pain or neck pain, and I can identify all the causes, and the average, by the way, is 4. Average patient presenting with chronic back pain has 4 causes. We've seen patients with as much as 7 causes, 8 causes, 10 causes of back pain. By the time they get here, they've got so many problems, and I recommend all 10 treatments, all 10 things. Now, some people don't listen. They just do 2 or 3 out of 10. And of course, they're still going to have pain afterwards, and then they're going to come back. All right, hopefully they come back and get it fixed. But I can't force people to do the treatments we recommend. A lot of people just want to do what they believe they need to do. So I appreciate you. I thank you for appreciating our animations. I put all my passion and knowledge into those animations because I think they're a very good educational tool. And they, I could talk about the tear and the inflammation and calcification all day long, but people won't be able to visualize it and understand it. And they say a picture's worth 1,000 words. So an animation has 200, 300 pictures. So that's, 20,000 words. And it does the job for me.
Next question. This coming from a patient post DLDR saying, after the cervical DLDR, still wearing the neck brace, I developed a cough. Will that disrupt healing or re-herniate the disc?
Cough can re-herniate the disc if you're not careful. So this is a question from one of our DLDR patients, cervical. We've had like 3 patients re-herniate with coughing, and here's the key. If you snap your head forward while you're coughing or sneezing or chew, okay, snapping the head down will increase the chance of re-herniation a lot. If you keep your head still and don't snap your head down, then you're not going to re-herniate, most likely. You could still tighten up your muscles like this, and that could put pressure on the discs, but I think it's a lot less if you're keeping your head straight. So if you wear the collar, that will help. As soon as the cough's gone, maybe take the collar off, okay?
And then lastly, coming from C Wong once more on YouTube, asking, can you do disc repair and I think they meant to say facet rhizotomy, in one surgery, or 2 surgeries are needed if the patient has both conditions?
Yeah, Siwong, we can do both the facet treatment and the disc treatment at the same time. In the lower back, it's easy to do. We do them at the same time. We usually will break it up into 2 streams so that we have one for facet, one for disc, but we do it in one surgery. For the neck, for the cervical, we can do it in one surgery as well, but we have to go through the back to do the facets. We go through the front to do the discs. So we start with the back. We have the patient laying down. So we start by intubating the patient for the neck. We put the tube down, put them on the ventilator, make them asleep, and then we start with the patient laying face down on the table. They're looking down, and I go in the back and I do the rhizotomy, and then we flip the patient onto their back, and then we do the Deuk laser disc repair. So we can do cervical, thoracic, lumbar, disc, and facets, same surgery, same time. We just have to do some maneuvering for the neck.
And then lastly, coming from Ping once more on Facebook, asking, how long are you at risk of coughing after the DLDR? 6 weeks or longer?
So Ping is asking, how long are you at risk for coughing and re-herniating after having the cervical Deuk laser disc repair?
Oh, and can crackling your neck cause re-herniation too? just added.
Can cracking your neck?
Yes, can cracking, yeah.
And can cracking your neck cause reherniation? So let me answer those questions. I believe that the risk of reherniating with coughing probably exists as high as 3 months after surgery. I would say by 6 months post-op, you're at virtually zero risk of reherniating with coughing, 6 months. Cracking your neck, yes, you can reherniate by cracking your neck for sure. Yes, you do not want to crack your neck after Deuk laser disc repair for 6 months. 6 months, you know, and I'd prefer you wait a year. So a year is safe, 6 months is pushing it.
That is it for questions.
All right, we'll be back in 20 minutes for our next surgery. Our next surgery is a very fascinating surgery. This patient comes from Michigan, I believe, or is it Missouri? All right, she's from out of state. I'll tell you a little bit about
Texas.
her. Oh, no,
Yeah.
not Texas.
Yeah.
No, I think we added one. It's a cervical.
Yeah, Texas. That's what it says.
They're not from Texas.
Right.
I'll find out where
I
she's from.
apologize, yeah, if I-
I'll find out. No, it's okay. We have people from all over the world. It gets a bit confusing. I could swear she's not, but maybe she is. I'll find out. Long story short, she came originally to us with symptoms of neck pain, tingling in her arms. She had the Deuk laser disc repair, 2 discs fixed. This was 8 months ago. She did fantastic. She was so happy. She was in heaven. And she called me and thanked me. And then a couple of months ago, she started having some discomfort in the back of her neck. And she was complaining of things like jaw pain and tingling in her ear. And I said, well, it could be facet joints. So she came back. We did her facets yesterday. We did a block, a numbing procedure where we numb up with Novocaine the facet joints from C5 to T1. And guess what? All of her symptoms went away. So she's back today to have the Deuk plasma rhizotomy on her facet joints in the neck. Okay? And she's next. We're going to be starting in about 15 minutes. But the facet joints, for those of you who don't know, Henry will show you the video animation. These are facet joints, and they get very painful, and they cause symptoms like neck pain or pain down the arm, tightening of the muscles. Even you can get radiculopathy from it. So I'm going to go in and I'm basically going to kill the pain nerves to these joints right through here. And I do that with my plasma wand. We're going to do a bilateral C5, 6, 6, 7, 7, 1. So three facets on each side. And she's going to be asleep for that. Not with a tube, but just a face mask on a CPAP and propofol sedation. All right, join us in 15 minutes for cervical Deuk plasma rhizotomy. Thank you.
Facet joint injury is a common cause.
A gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the
The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call